Before science gave it a name, before microscopes found a shape for the pain, there was a story, a whisper carried on the harmattan wind, carried in mother's songs and father's silences. It was the story of the child who was born to live. The visitor who loved its mother dearly but could never stay for too long. In Yoruba belief, they were called Abiku, spirit children caught between worlds, returning again and again to torment their parents. In Igbo culture, they were called Ogbanje, trickster souls who slipped in and out of life. Families carved talisman, tied protective beads, buried sacred objects to persuade these children to stay. These repeated illnesses wasn't seen as a failure of the body, but as a negotiation with the spirit world. This belief was so woven into the cultural fabric that it lived in the pages of our greatest stories. In Wole Soyinka's haunting poem, Abiku, and in Chinua Achebe's Things Fall Apart, where Ezima, the beloved daughter feared to be an Ogbanje, becomes the first of 10 children to survive infancy. A story mirrored the reality of countless Nigerian families. These myths gave language to a suffering no one yet understood. But under the lens of a microscope, another story was being told. In 1910, in a Chicago hospital, Dr. James Herrick examined the blood of a young Grenadian student, Walter Clement Noel. In his patient's blood, he saw something no one had ever documented: peculiar elongated sickle-shaped cells. It was the first formal medical description of the disease. By the 1940s, scientists would call it the world's first molecular disease. How did this global discovery reach the communities that had known Abiku for centuries? In Nigeria, the bridge from myth to medicine was built in the 1950s. Doctors confirmed that this strange blood flowed through the veins of Nigeria. In the West African Medical Journal of 1952, Dr. C.A. Thomas documented cases of sickle cell anemia among Nigerian patients. Hospitals like UCH Ibadan and LUTH Lagos became the first centers of recognition. By the 1960s, a new generation of Nigerian doctors began to give it a place in the nation's medical vocabulary. Among them was Dr. Olufemi Akinyoju, who, after training in London, returned to Lagos to diagnose, treat, and eventually build one of the country's most important institutions for care, the Sickle Cell Foundation Nigeria. Established in 1994, he and his generation of doctors started the slow, vital work of turning a lab result into a public conversation. The 1970s to 90s brought more than clinical recognition. Public health campaigns carried the message into daily lives. Newspapers ran stark adverts warning against SS marriages. Community theaters staged cautionary plays. NTA jingles and radio spots filled the airwaves. Before you say I do, know your genotype. The fear of Abiku was replaced by the fear of incompatible unions. While awareness grew, a new generation of leaders stepped forward. Scientists, doctors, and advocates began building the infrastructure of care. They built foundations, pursued groundbreaking research, and transformed traditional knowledge into modern medicine. In the late 1980s, Nigeria's National Institute for Pharmaceutical Research and Development, NIPRD, worked with Reverend Paul Ogunyale to transform a Yoruba herbal remedy into Nipresan, a phytomedicine for managing sickle cell. For scientists like Professor Sunday Fadulu, whose own brothers had died of the disease, the work was deeply personal, and researchers like Professor Adeyinka Falusi advanced genetic studies and advocacy, bringing global recognition to Nigerian science. However, sickle cell advocacy was never only in laboratories or hospitals. In 1996, Nollywood put a face to the struggle, Mortal Inheritance. Starring Omotola Jalade Kende, told the story of a woman navigating love and the reality of sickle cell anemia. For many Nigerians, it was revolutionary. For the first time, this private, often shameful family struggle was on screen for everyone to see. It humanized the disease and made it part of a national conversation. And in the 2000s, a new voice emerged on the airwaves. clear, fearless, and impossible to ignore. Tosin Bucknor, a beloved media personality, did something radical. She shared her story openly and without shame in a country where silence and stigma had long shaped the sickle cell conversation. Tosin transformed the image of the sufferer into that of the warrior.
My name is Oladimeji Yetunde Ajayi Abisola Bucknor. Tosin Bucknor, a morning radio host with Top Radio 90.9. I'm also Contradiction, a singer-songwriter, and yes, I have an...
In December 2007, she founded These Genes Project, determined to show that sickle cell was not just a medical condition, but part of everyday Nigerian life. Her vision was bold, to ensure that warriors and their families had a safe space to share experiences, find strength, and foster empathy, with a focus on the emotional and psychological aspects of the disease. These genes created awareness through entertainment and media, using Tosin's own presence on radio, television, and print to bring the conversation into living rooms across the nation. She built community through initiatives like Teenage Genes, a monthly workshop where teenagers living with sickle cell could share their struggles and joys, pull from each other's strength, and grow in confidence. She made advocacy fun and fashionable, organizing events like Jeans for Genes, a fashion exhibition and fundraiser featuring Nigerian designers, music, and art. She even declared October 31st as These Genes Day, encouraging Nigerians to tell at least 5 people about sickle cell to spread awareness far and wide. Through her work, Tosin shifted the paradigm. She showed that warriors could live boldly, joyfully, and fully. She reminded Nigeria that those with sickle cell were not defined by fragility but by resilience, creativity, and heart. In her own words and actions, Tosin proved that humans need to be understood emotionally as much as they need air physically. She gave warriors something beyond medicine. She gave them representation, community, and pride. Through these genes, Tosin changed how an entire generation of young Nigerians living with sickle cell saw themselves, not as sufferers bound by limitations, but as fighters, as warriors, as people whose lives could be limitless.
Hi everyone, it's the voice of Lagos, Tosin Bucknor. Hey, let's show support for people living with sickle cell disorder by coming out for the Bring It On comedy event. But in the end, who are you living your life for? Because when you die, you're truly going to be by yourself.
Not long after, cinema once again carried the torch. In 2014, legendary filmmaker Tunde Kelani released Dazzling Mirage, adapted from a novel of Olayinka Egbokare. The film told the story of Fumiwo, a young woman living with sickle cell, played by Kemi Lala Akindoju. Unlike earlier portrayals that focused on fragility, Dazzling Mirage was layered with music, poetry, and love, showing a warrior who dreamed, worked, fell in love, and demanded to be seen in her wholeness. For Kelani, it was more than film. It was a cultural intervention. And for a few generations of Nigerians, it cemented sickle cell as part of our collective story, carried not in whispers but on the nation's big screens. From the cinema screen, the movement spilled into everyday life. Warriors began reclaiming their stories through art, fashion, photography, music, and even poetry. What had once been whispered in myth was now spoken word on stages, weaved into musical lyrics, painted boldly on canvases, and staged into fabric on runways. Awareness campaigns painted cities red, while Instagram feeds began living galleries of resilience. From folklore to film to social media, the story has come full circle. The one who was once spoken for now speaks for themselves. Today, the story lives both in science and in art. In Kano, newborns are screened before their first cries fades. At Abuja Center of Excellence, Sparkle Nigeria is working to build national databases that connect thousands of patients and standardized care. Gene therapy research pushes the boundaries of possibility. And online, warriors flood timelines with their own words, beauty, and defiance. Alongside them, advocacy groups keep the fight alive. SAMI, Sickle Cell Advocacy and Management Initiative, reaching families with education and clinical support. The Adekunle Gold Foundation, turning personal experience into a national movement. And a new generation of grassroots initiatives, blending awareness with art, fashion, and storytelling. Together, they ensure the narrative is not only medical, but cultural, personal, and profoundly Nigerian.
Hi, Sickle Cell Warriors. I'm Oladimeji. I'm an advocate. I'm your friend. I'm a fellow warrior. And today, I'm here to challenge you. Yes. Have you taken water today? Can't hear you. You've not. You're not feeling thirsty. Oh, it's not sweet. But do you know that hydration is key in managing sickle cell symptoms? And it can also help to boost circulation. You also know that it can help when you have pain crisis. So you know all of this, yet you're not taking enough water. Trust me, I know it's easier said than done.
The journey of sickle cell in Nigeria is a story of resilience written in blood. A story that began with a myth about spirits and is now leading a global conversation on genetics, identity, and care. The work is not over, but today, the story is no longer about who might leave. It is about the millions who have stayed, who have fought, and who are reimagining what it means to live.